So my name is Leisa Bellmore, and I've been in practice as a Shiatsu Therapist for well over 10 years now. And a really key element of my practice is education. So whether that's with clients on a one-on-one basis or in presentations and workshops with groups, I really love giving people the tools that they need to improve and maintain their health. So to that end, today I'd like to speak to you about how stress impacts our health and how we can impact our stress levels. So just out of curiosity, could I get a show of hands? How many of you have been stressed in the past year? And in the past month? In the past week? Hopefully not too many today. No one today. Good. Okay. Well, yes. But you're allowed to. You've been working hard. So that just clearly indicates that we're all affected by stress. It's part of all of our lives. The World Health Organization has called stress the epidemic of the 21st century. But how we manage that stress will really determine the impact of its effects on our on our health and on our lives. So stress can mean different things to different people. When I refer to stress today, I'm talking about psychological stress. And that can be defined quite simply as a reaction that we have in response to a demand. So that demand causes a stress response in the body. And even positive and negative situations can cause a stress effect. So you may, for example, get a promotion at work. That's a positive thing. Or you might lose your job, very negative thing. Both of those things will cause a stress response in the body. Second slide, please. It's important to remember that small amounts of stress can be beneficial to us. It can help us to perform at our best, it can help us to focus, and it can motivate us. However, greater amounts, and especially ongoing chronic stress, can really take a toll on our health. So the stress response is our body's way of rising to a challenge to protect us. So it exists for a reason, and it's meant to keep us safe in dangerous, potentially dangerous situations. And when our bodies mount a stress response, there are a number of things that occur. The stress response is a really complex physiological process. It affects us mentally, it affects us physically, and it affects us emotionally. And part of the problem with stress is that the reaction we have to it doesn't end as soon as that stress is removed. So the effects linger on in the body. And for those of us living with a chronic health condition, of course, your bodies are already working hard to cope with the symptoms that you experience as part of your illness. Simply living with chronic illness is stressful. You all know that. Stress is just part of chronic illness, and it arises from the symptoms that we experience and from the restrictions that that condition can put on us. So when you consider that chronic stress weakens the immune system and impedes the healing process, it's really no surprise that any existing health condition can be exacerbated by stress. And those symptoms that you have as part of your chronic illness can become even worse. So if we can relieve our stress, we can prevent putting further strain on the body. So let's think about some of the effects of stress. When we're under stress, the brain triggers the release of certain hormones, like epinephrine, norepinephrine, dopamine, and especially cortisol. And these hormones are released into the bloodstream, and they then have a physical reaction in the body. And we feel all sorts of different effects from them. They affect nearly every part of the body. They affect the cardiovascular system, part of the nervous system that controls can everyone hear me all right? Okay, good. There's a lot of waving going on there. So they also affect part of the nervous system that controls the digestive system, the glands, the skin, and the heart, and they affect the respiratory system. So that's especially important for those of you with lung-related alpha-1 antitrypsin deficiency. Some of the immediate effects can include changes to blood flow, changes to blood sugar, changes to heart rate, our hearts start to beat more rapidly, and changes to breathing. So our breath tends to become rapid and shallow. And again, for those of you with lung-related alpha-1 antitrypsin deficiency, that's a really important factor. So, if a person is under frequent stress, as some of us are, we can become sensitized to it. So, even a minute amount of stress, maybe from missing a bus or spilling your coffee, something that in the grand scheme of things really doesn't matter, something like that can trigger a stress response in the body, even though you may not feel particularly stressed about the situation. So our bodies can no longer differentiate between what is potentially a life-threatening situation or a dangerous situation and some minor trivial event. And our bodies mount that stress response. The brain no longer behaves as it should. It behaves inappropriately, and it causes the release of either too many hormones that excite the body or too few that calm it down. And it releases all of these hormones again. So to put it quite simply, continual stress diminishes our ability to effectively cope with stress. So you're all familiar with some of the short-term effects of stress, things like irritability, difficulty sleeping, headaches, upset stomach, what else? Shortness of breath, rapid shallow breathing, muscular tension, anxiety, inability to concentrate. Sustained stress has also been shown to have a really powerful impact on brain function. And it affects the part of the brain that is key for learning and memory. So it impedes our ability to create new memories and to access existing ones. Long-term chronic stress, of course, has a really profound effect on health. It's been proven that it's a factor in countless health conditions, things like cardiovascular disease, hypertension, strokes, diabetes, asthma, skin conditions including allergies, chronic pain syndrome, fibromyalgia, even Alzheimer's disease. The list goes on and on. Slide 3. Next slide, please. Thanks. Okay. We're having technical difficulties.
Can I get you to?
There you go.
So,
Is it cut out now?
sorry about
It's
that.
sounding good from here because I'm moving speakers.
Did you say you had to go?
That's fine.
Okay.
I can be here.
Yeah, okay.
Okay, thank you. No worries, that's fine. Okay, so can everyone hear me all right now at the back? Yeah? Was I really fading in and out that much? It sounded so good from up here. Okay. Well, okay, so just as the good news is that just as there are numerous causes of stress, and it varies for all of us, we're all individuals, so there are different things that will trigger us and set us off, there are numerous ways to alleviate it. Stretching and Shiatsu are both very effective for this, and we'll learn some of those techniques shortly. Quiet, calming pursuits like mindfulness-based practices and meditation can ease stress and leave you feeling grounded and more in tune with yourself. And the beauty of these is that you don't need any special equipment, you just need a quiet space to practice them in. Movement-based practices like Tai Chi, Qigong, and yoga are wonderful for stretching out tight muscles and for boosting circulation. And the slow, sometimes repetitive movements of them can really create calm. as Linda was saying, any type of physical exercise, and I think some of our panel was saying that as well, any type of physical exercise is fantastic for alleviating stress, even if it is something gentle like walking. So you can certainly do something that is within your own physical limits, and you will benefit from it, especially if done regularly. And exercise causes the release of endorphins, which are a feel-good hormone. And they not only decrease tension and anxiety, but they also block pain, and they decrease levels of cortisol, the main stress hormone. And of course, proper sleeping habits and good eating habits can really make a big difference as well. Next slide, please. So stretching is a great way to ease stress and tension, and it was great to see that Linda incorporated some stretching with her breathing exercises. Again, this is something you can do almost anywhere. You don't need any special equipment. You don't even need a lot of time. Even if you do a few minutes a day, you will notice a difference. There are a few things that you should keep in mind when we get around to doing the stretches. First, you should always stretch within your own comfort level. You should never force a stretch. And don't worry if the person sitting next to you is stretching much further. Everyone has different levels of flexibility and range of motion, and that's fine. Secondly, you should never bounce into a stretch, but you should move slowly and smoothly into it. And then once you feel a comfortable stretch in your muscles, hold it there and then slowly release. The key is that it should always be comfortable for you. You shouldn't be forcing it or pushing yourself too far. So the stretches are described on page 1 of the handouts that were in your kit, so you'll have them at home for your reference, but I'll have them up here on the screen and I'll talk you through them. So next slide, please. So the first one is a shoulder roll. And you can do these either seated or standing, however you're more comfortable. If you're seated, you're going to make sure that you're sitting up straight, your shoulders are down in a relaxed position, and your spine is straight. And you're going to slowly push your shoulders back as far as you can. So you're bringing your shoulder blades together, and then very slowly shrug them up and around to the front as far as possible, until they rest in their normal position again. And we'll do that just once more because everyone has tension in their shoulders. So up and around very slowly, and back to their normal position. This is great for releasing tension in the top of the shoulders and between the shoulder blades as well. And it will help to open up your upper chest as well, which again is great for those of you with issues with breathing. So then you can do that in the opposite direction. So you pull your shoulders as far forward as you can, and then very slowly shrug them up and around to the back as far as possible. And just once more. So pull them forward and very slowly shrug them up and around to the back as far as possible. I don't know about you, but I heard a bit of crunching in here when I did that. All right, so next slide, please. So the next one we'll do is for the neck. This stretches the muscles in the side of the neck and into the top of the shoulders as well. And again, you can do this seated. So you're going to begin, you're going to keep your shoulders down in a comfortable position, your spine straight and your face facing forward. You're going to place your right hand just above your left elbow, and you're going to slowly tilt your head toward the right so that your ear is moving toward your shoulder. And just hold that for 15 seconds or so, and then gradually release. And we'll do that just once more. So again, your hand is still there. The purpose of having your hand there is just to prevent you from raising your shoulder up while you do that. It just makes you aware of keeping that down. So again, your hand is on your elbow, and you tilt your head slowly to the other side. And release. And then we'll do that for the right side as well. So your left hand on your right elbow, and slowly tilt your head toward the left. And then slowly release. And just once more. So again, just slowly, your ear moves toward your shoulder. and release. Did anyone find the second time they had a little bit more range of motion there? That's great. Okay, so the next one is for the back of the neck. And again, you're going to sit with your spine straight, your shoulders are down. You're going to link your hands together and place them on the crown of your head. Now be careful not to raise your shoulders up when you do that, but keep them down and relaxed. And then just slowly pull your head forward so that your chin moves toward your chest, just till you feel a comfortable stretch in the back of the neck. And then release. And just once more. And again, this is great for the muscles along the back of the neck, the cervical spine. Just slowly pull forward. And then release. And there's just one more stretch that we'll do. And this one is for the entire arm and the front of the shoulder. So again, it's really great for stretching out the upper chest. So you can begin, some of you may have to stand up to avoid hitting your neighbor. You can do it seated if you've got space around you. Or you may have to stand. So again, you begin with your arms at your sides, your shoulders are down and relaxed. And you're going to raise your left arm with your palm facing forward. And then you're going to bring your hand back just slightly and then slowly move your arm back as far as is comfortable. And you should feel a stretch up your arm and in here as well. We'll do that then just drop your arm and shake it out. We'll do that once more. If you bring your hand back severely when you're doing this, you're going to feel all of the stretch in here. And if you're someone who works with your hands or is on a computer a lot, that's great, but we really want to try opening this up. So again, your arm is up, and just bring the hand back slightly, and then bring the arm back as far as is comfortable. And then just drop it and shake your arm out. And just with the right side as well, shift so you're not hitting your neighbor. So again, bring your arm up with your palm forward, bring your hand back slightly, and then bring your arm back. And then just drop and shake out. And just once more. So again, your arm up again. You don't have to bring your arm up so it's perpendicular. You can have it lower, wherever you're comfortable. So the hand back, and then the arm back as far as comfortable. And then just drop and shake out. Does anyone feel just a little bit looser from that? Yeah? Good. And you see that was only about 5 minutes or so. So even if you just find 5 minutes a day to do that, it's fantastic. It will have an effect. So I know all of you are wondering what a Shiatsu therapist is. Has anyone here actually had Shiatsu before? Excellent. 3 of us then. Good. And does anyone have sort of some vague idea of what it is? A couple people? Okay. Good. Well, I love introducing it to people. It's a Japanese type of massage, but it's based on traditional Chinese medicine. Oh, the next slide, please. So Shiatsu as a standalone discipline has only been around for about 75 years. It's fairly new. But it's based on traditional Chinese medicine, which has been around for thousands of years. And the word shiatsu actually is Japanese for finger pressure, so that gives you a good idea of what it's about. It involves the comfortable application of sustained pressure to specific points on the body. And there are points all over the body. If you go for a professional treatment, it will often be a full body treatment, although the therapist will focus, of course, on your specific health needs. And certainly doing self-shiatsu on specific parts of the body, which we'll learn in a bit, can be very, very effective, especially if you're doing it regularly. So if you're looking at it from an Eastern perspective, the points follow meridians, and meridians are thought to be invisible pathways that run up and down the body, and our chi or vital life energy is thought to flow through these pathways. And it's said that pressure to specific points can prevent energy blockages, it can increase energy, and it can help to restore balance to the body. Now, if you look at it from a more Western perspective, which is the way that I studied, the points are based on anatomy. So they tend to follow muscle lines, nerve pathways, and blood vessels. And the pressure can relieve pain, it increases circulation, it can boost the immune system, release muscular tension, and just help the muscles, nerves, and the vital organs to function at their best. Shiatsu is used for relaxation, for preventive care, and to treat specific conditions, both acute and chronic. And it is excellent for stress management. I'd say probably 85 to 90% of the clients that I see list stress management as one of the reasons they come for treatment. So when we get around to doing the self-shiatsu, you'll be using the pads of your thumb or your finger to apply pressure to the points. Sometimes the palm is used, although we won't be doing any of that today. And you will be gradually increasing the pressure, holding it for 5 or 6 seconds or so, and then gradually releasing. And the pressure, the most important thing I can tell you, pressure should always be comfortable for you. So it should not be creating any pain at all. It should be within your own comfort level. And some people have different pain tolerance, different sensitivities. If someone is not in a very good state of health, you should be using gentler pressure. So make sure that it is comfortable for you. Usually a series of shiatsu points is repeated several times, and the purpose of that is that it really increases the circulation a lot more, and it really enhances relaxation. I've put many clients to sleep. The beauty of shiatsu is that it can be used on absolutely anyone, regardless of their health. So people with serious medical conditions, it can still be used on them. You use gentler pressure. You'd use gentler pressure on people who are extremely elderly or very young children as well. But it can be used on anyone regardless of their health. I work at Ronald McDonald House. I treat a lot of kids who have had either they've had organ transplants, lung transplants, kidney transplants, or heart transplants, bone marrow, or kids who are going through treatments for different cancers. And because they're in a delicate state of health, you have to use gentle pressure with them, but it is still beneficial. And if they're getting that regularly, you really do see differences in the side effects that they have from the treatments if they're doing chemo or radiation. And you see differences in their symptoms as well. Their symptoms can be a little bit better managed. So, again, these points are in your handouts for your reference at home, but we'll have them up here. And if you don't feel like doing them now, that's fine. Definitely try them out at home, though. So, the next slide, please. So we're going to start with the lateral cervical, that's the side of the neck. And there are 4 points. The first point is just below the ear on the neck. The 4th point is at the base of the neck. We're going to do the left side and then the right side. So the easiest way is to reach your right hand across to your left side. So your first point is just below the ear on the muscles of the neck, and you're working down. And again, you're going to gradually increase the pressure. And it's easiest if you use 2 fingers held together. That just gives you a little bit more strength and stability. So you increase to a comfortable level. It doesn't need to be very hard. And then slowly release. And then the next point just below that. Again, you gradually increase the pressure and hold for about 5 seconds or so. And then slowly release. And the 3rd point just below that. Again, hold for 5 seconds or so, and then slowly release. And the 4th point is just at the base of the neck before the curve of the shoulder. So again, gradually increase the pressure, and then slowly release. And we'll repeat those once. Shake your hand out. I know for people who aren't used to doing this, it can be a bit of strain. So we'll repeat that once. And don't worry about being 100% accurate with the points. If you're slightly off, you're not going to be causing any harm, especially if you're using gentle pressure. you'll still be increasing the circulation and you'll still be easing the tension in the muscles. So again, your first point just below the ear, and the next point just below that. Your third point just a little bit further down. And your fourth point just at the base of the neck. And again, shake your hand out a bit. And then we'll do the right side. So this time you're bringing your left hand across, and again, use 2 fingers held together. And gradually increase the pressure there. And hold, and then slowly release. And the second point just below. And slowly release. And the third point a little further down. And the fourth point at the base of the neck. And we'll repeat that just once more as well. So again, slowly increase the pressure. Make sure it's comfortable for you. Sometimes with the second or the third repetition, you can use slightly stronger pressure as your muscles sort of get used to it and loosen up a bit. You may find some points feel a little bit more tender than others. Don't be concerned about that. You know, everyone has different areas that will be tighter. And if you do find a point that's particularly tender, just use gentle pressure. You can use lighter pressure than what you've been using previously, and you can hold it for longer if you wish, or you can repeat it a few times. Is the neck an area that most of you carry tension in? It is for a lot of people, the neck, shoulders. Okay, so the next one we're going to do, when our audio-visual guy is ready, no rush, is the suboccipital area. So there are 3 points on each side of the neck, below the base of the skull. And the easiest way to do these is to do both sides at the same time if you're doing them on yourself. And you can either do this if you wish, or I prefer to link my hands together and bring my hands up and use my thumbs to apply the pressure. So you're pressing along the top of the neck, beneath the base of the skull, and you're working toward the spine so that your third point is on either side of the spine. So you're not pressing directly on the bones of the vertebrae. You're pressing on either side, on the muscles. So again, you're going to gradually increase the pressure and hold it at a comfortable level, and then gradually release and move on to the next one. I don't think I've met a client yet who doesn't have tension in this area. So again, that third point is on either side of the spine. And then we'll repeat that once as well. So again, gradually increase the pressure. So your first point is sort of a little bit back from the ear and below the base of the skull there. And since there's only 3 points, we might as well do them 3 times. So again, gradually increase the pressure. Make sure it's comfortable for you. Don't worry if the left side feels very different than the right. None of us are symmetrical. And then when you finish that, drop your arms and shake them out to get the circulation going back into them. You have to remember that we carry around our heads all day, every day, and the human head weighs 8 to 10 pounds. So all of these muscles back here are working really hard to keep our head up and to keep it in place, prevent it, especially if we tend to stick our head out like this while we're sitting at our computer. These muscles are working much harder than they need to. So the next ones we'll do are the posterior cervical, so that's the back of the neck. And again, there are 4 points. starting from the top of the neck and running down to the base of the neck. And again, they're on either side of the spine, so you're not pressing directly on the vertebrae, but you're pressing on the muscles at either side of them. And I think it's easiest if you we'll do one side and then we'll do the left side, then the right side. And it's probably easiest if you reach your arm around like this. If you have difficulty raising your arm up, you can certainly use your left hand on your left side in this manner, if that's more comfortable. So again, the first point is just below the base of the skull, to the left of the spine. And again, you're using comfortable pressure. You can use two of your fingers held together again, either your index and middle finger or your middle finger and ring finger, whatever feels more natural for you. And you're working down so that your fourth point is just at the base of the neck. And we'll repeat those once. So again, back up to the first point and slowly increase and hold, and then slowly release. Working your way down slowly. And then when you finish that, again, drop your hand and give it a rest. And with the left hand, reach around, and you're going to work on the right side now. So again, starting at the top, just beneath the base of the skull, slowly increase the pressure and hold, and then slowly release. And keep breathing normally. If you think of it, you can even use the pursed breathing technique that Linda was demonstrating. Ideally, if you press out through pursed lips as you're applying the pressure, but don't force yourself to breathe in that rhythm if it's not natural. Just remember to keep breathing. And repeat that a second time as well. Does everyone's neck feel a little bit looser now? Good. Okay, so just two more areas that we'll do. So we're going to do a few points on the face. When we're stressed, aside from hunching our shoulders up and tensing everything up here, we also carry a lot of tension in our head. So not only across our forehead, but across our whole skull. It's amazing. We don't think of this as having much muscle, but there are muscles there, and there is fascia that's connected to everything else. So when everything else becomes tense, so does this. So next slide, please. So there are 3 points. I skipped a part. Oh, terrible. Okay. Before we get to the face, back one, please. Before we get to the face, we're going to do along the top of the shoulders. So this is called the suprascapular area because it's above our scapula. And there are 3 points on each side. First point is just beside the base of the neck, so just at the edge of the shoulder there. Next point just beside that. Your third point is before the bones of the shoulder joint. So if you feel your bones here, if you feel your bones here, you're not pressing on them, but you're pressing on the muscle beside. So beginning closest to the neck, and it's easiest if you reach your right hand across, which I can't do with my mic. And again, use 2 fingers held together and gradually increase the pressure. Again, don't worry too much if you're 100% accurate. Hold that and slowly release. And then the second point is just beside. And the third point just before the bones of the shoulder joint. And we can repeat that once, Toyan, as well. Again, I don't think I've met anyone who doesn't have tension in this area, regardless of their health condition. I'm just going to repeat mine again because really I've got a lot of tension there. Okay, and then you can do the left side. The right side, reach your left hand across. And again, the first point just beside the base of the neck at the top of the shoulder. And make sure the pressure is comfortable for you. And the next point just beside that. And the third point just before the bones of the shoulder joint. And you can repeat that once too. Is anyone finding they have tender areas in here? Yeah. We use these muscles a lot. Okay, so now we're going to go on to the points on the forehead. So there are first 3 points that run straight up the midline of the forehead. They run from bottom to top. So the first point is just above the brow line, right in the middle of the forehead. And you can either use 2 fingers over top of each other. It's easiest if you tilt your head forward slightly, then you don't have to use as much force with your hands and arms. So that first point just above the brow line, and then the second point just above that in the middle of the forehead. Your third point just above that, so it's below the hairline. And again, you can repeat that once. Your second point in the middle of the forehead. And your third point just below the hairline. These points are great for headaches too, if you happen to have a headache. All right, so our next slide, we're going to do, from those points, we're going to do 3 rows of 4 points that run from the midline out to the left, and then from the midline out to the right. So the left side first. So you start with your first point right on the midline, just above the brow line. And again, if you tilt your head forward, you don't need to work so hard with your arm. And you're working out to the left toward the edge of your forehead. And again, make sure the pressure is very comfortable for you. It doesn't need to be very strong. So your fourth point is just above the end of your eyebrow, essentially. So you're not pressing on the temple here, but you're pressing on the edge, outer edge of the forehead. And then you go up to the second row. So again, you're starting with that point in the middle of your forehead and working your way out toward the left, 4 points. Again, gradually increase the pressure and hold it at a comfortable level before you release. And then up to the top row. So again, your first point in the middle of the forehead, just below the hairline, and the row extending to the left, again, below the hairline. And you can certainly use 2 fingers held together if that's easier for you, or 2 fingers stacked on top of each other again, just to give you more strength and stability. So now we'll do the right side. So again, you start in the middle. And moving out toward the right. And again, you're just above the brow line. And then up to the second row, beginning in the middle again. And working your way out to the left, to the edge of the forehead. Sorry, to the right. And the top row. Again, just below the hairline. And when you're finished, shake your hand out and get the circulation back into them. So how did that feel? Did that feel good? Did it relieve some of the tension in the muscles? Okay, good. So as you can see, these points are all really easy to access. You can do this pretty much anywhere. So if you're sitting and have a break at work, or even while you're reading emails at work, or if you're at home watching TV in the evening, or sitting in the doctor's office waiting to be called in, you can easily hit a few of these points. And if you find a particular area is really effective for you, then by all means do more repetitions of that. If you find another area isn't so great for you, do less of that or don't do it at all. If you find an area that's really tender, make sure that you use gentle pressure, and by all means you can sustain the pressure for longer, hold it for 30 seconds or 60 seconds or so, or just repeat it a few times. And you can certainly personalize this to turn it into a routine that really works for you. Whatever feels good, go with that. If you decide to try this on a family member or a friend, that's fine, but make sure if they are quite elderly or a young child, you're using gentle pressure. And if they are not in a very good state of health, again, use gentle pressure. And make sure that you check in with them as well. So not only ask them to tell you when it's not feeling so good, if it's a little bit too tender or uncomfortable, but make sure that they give you positive feedback as well and tell you what feels particularly good for them, because then you'll get an idea as to how much pressure they need and how much pressure you should be using. So all of the techniques that we covered this afternoon are really fairly simple. Oh, next slide, please. And they can easily be incorporated into your daily routine. Even if you can only find a few minutes each day, or maybe you can squeeze in 10 or 15 minutes every other day, it will have an impact on your stress levels. And the other really important aspect of this is that if you take an active role in your health care and in managing your stress, you will really realize that you're in control of your stress. It is not controlling you. And that is really important. And especially for people with alpha-1 antitrypsin deficiency, it can have an effect on some of the symptoms that you experience as well. So with chronic conditions in particular, whether that's AAT deficiency or migraines or fibromyalgia or whatever, people will often feel really frustrated by their situation. And if there's something that you can do yourself that has an impact, that can help you to manage your illness, then it really does change your whole outlook. And if you have a more positive outlook on your situation, then it can really impact your illness. So, next slide. Thank you so much for your attention today and your participation. I really appreciate that.